heard it on the news, not sure what it is. And then finally, once it hit us and we start to have patients here, it's like, oh my God, this is real.
We did get our first COVID patient in mid-March. So we're like, okay, we have our first COVID patient. We expected that we would have at least one patient. And then as the days go by, it's 2 patients and 3 patients and 4 patients.
Very quickly, it escalated to going from just a few to 10 to 20, and the numbers just went up from there. So we had to pivot and change very quickly to be able to accommodate the huge influx of patients, but also to prepare the staff.
We had to upgrade med-surg capabilities into ICU capabilities. We created new inpatient units out of thin air in order to accommodate for all of the patients coming in.
It literally turned our lives upside down. Everything changed in the hospital. We went from dealing with general medicine as a heart failure, things like that, and then we went up to the entire COVID-19 hospital.
It was a lot to handle, and it was a lot of adapting to different rules. Every time we would get something from the CDC and the hospital relay it to us, we would try to stay on top of it and implement it as soon as the recommendations were coming out.
COVID-19 impacted myself and colleagues in such a way that we had to bond together more closely. We had to be there for one another, to strengthen one another, because every department that we went to, they was looking for us for strength. We just was there for one another, making sure that we had one another's back during this difficult time.
There was many of our team members that was fearful. They obviously did not want to get sick, and most importantly, they were concerned about their family. And so it was up to us as the management team to really provide them with support, acknowledge the fact that, yes, this is a new territory for us, and it is frightening, it is scary, but we're gonna get through this, and we're gonna get through this together. I would say the whole hospital really came together to come up with a plan. We opened up our command center, and it was open 24 hours, 7 days a week.
For me and my team, just keeping them motivated every day was very difficult. But with the leadership that we have here in the facility and the great support that we receive each day was monumental.
On April 5th, I came home from work after teaching, and I knew immediately that I was unwell. And that evening, I had a fever of 103, which did not break for almost 10 days. I was so weak. I said, I have to go to the hospital, because I was really afraid for my own life at that point. And I got myself ready, and my sister drove me to the hospital. And afterwards, she was so frightened that that would be the last time that she would see me. And quite frankly, I was too, because it was so unpredictable.
I was actually doing the temperature screenings one day, and this woman came to the emergency department with her family. Her son brought her in for shortness of breath. So we brought her to the back immediately, and they did what they could for her, but it was ultimately too late. And it was just really heartbreaking to me, because her son had literally brought her in not even 2 hours ago to have her seen, and then we were having to call him back and saying that she passed away. And it's really difficult, that was really, I thought about that a lot when I got home.
So when they put me in the room, I was on isolation. Everyone that came in to speak to me had to wear the gown and the gloves and the mask. And shortly after I was admitted to C4, there were 3 codes called within an hour. And I could hear the nurses scrambling to go in to help whoever was in dire need at that moment. And unfortunately, I found out after that none of those people survived.
We had no time for the healing process, because it was death after death after death. So we had to rely on one another, and in our own way, find the strength that we need to grieve the loss of a human life.
Some of the hardest things for me was just knowing that visitors were not allowed to come and see their family, take their last breath. And those things are not something you can redo.
It felt devastating, that type of aura when you walk into the hospital, when you have so many sick people and their family members couldn't come into the hospital in order to be with them during their time of need. We were there for them.
We're so fortunate we live in a time with FaceTime right now. My daughters could see me from Florida, so I was so grateful that we had that technology. And then also our nurses used that, not just with me, but with our patients that had the ability to connect with their families while they were here, by themselves.
Our people never failed us. They stepped up every day. Every day I sat in my office and sometimes I cried in my bathroom and thought to myself, please God, just let them show up tomorrow. Let them come back tomorrow. And every day our people showed up and they did the job for the benefit of the patients and for the benefit of our community. It was humbling to see.
I think one of the biggest morale boosters during that course of time is just the amount of support that we got from local businesses, from local restaurants, from local people, from people not even locally, but a little bit far away, who just donated so much support to our hospital in that moment of time.
I remember one day in particular, we all went outside and the Newark Police Department had like a parade kind of, and they're all beeping the horns. And it was just like really nice to know that all the frontline workers were all like there for each other as well, because we're already working so closely every day, and it was just really reassuring, and it made the job a whole lot easier knowing that they were there supporting us too.
I am very proud of the care that we delivered. I am proud of the way that we were able to work together, not only internally here, but throughout our system, sharing ideas and sharing policies and sharing processes and best practices, basically. And I think that that is also why we were able to successfully take care of a lot of patients. Unfortunately, we lost the patients throughout the New Jersey, but the amount of patients that we were able to help and save and they were able to walk out of the hospital is amazing.
At the end of my hospitalization, they came to me and asked me, would I mind being clapped out? And I was like, okay, sure, that's fine. And I put on my winter coat, and actually Mr. Darrell Terry came to roll me out, and it was so emotional. I think right then and there we were so challenged with so many people dying, and to see your colleague actually survive, and so many people gave me well wishes leaving the facility and making it out, and it was just such an emotional roller coaster.
Here it's just family. Being a part of the Beth family is very special to me, and it's dear to me.
I love working here, I love the people that I work with, and I'm just really proud of the way that we were able to come together.
I am saddened because we are not out of the pandemic yet, and I do anticipate that this winter will be a challenging time, but I am grateful that I know that we have the right people that will rise to the challenge when called.